Occupational therapy, it stands on the words occupation. So, occupation for different age groups are absolutely different. We have to find out in which texture or in which way the child is becoming calm. All of us should include the child in every social activities or social participation, whether it is neurotypical child or whether it is neurodiverse child. Every child is flower and every child has their own right to enjoy everything.
Hello everyone, welcome back to India Autism Center podcast, your go-to destination for powerful and insightful stories on inclusion, autism spectrum disorder, neurodiversity, and above all, awareness and empowerment of community. Today, I am your host for the session, Ms. Pooja Datta, and we will be discussing the efficacy of occupational therapy for individuals in the spectrum, which is not only scientifically rooted, but also it is compassionate in nature. To discuss this, we have with us Dr. Abhirupa Dutta Chakraborty, who is an occupational therapist, and she will be giving us more insights and inputs on occupational therapy and how it works for individuals in the spectrum. So, Dr. Chakraborty, welcome to the podcast. We are
Thank you
privileged
so
to have
much.
you. We are privileged to have you in this session. How are you today?
I'm absolutely fine, and it is really very good when you are back to your own city, Kolkata. And how are you?
I'm good. I'm good. Thank you so much. So, to start with, can you please share your professional journey briefly to us and how did it align with autism?
Yes, of course. So, I'm Dr. Abhirupa. I'm a pediatric occupational therapist and a certified play therapist and ergonomist expert, you can say. So, it was 7 years before when I started to work in occupational therapy. When I started occupational therapy, I really didn't get what is occupational therapy. When I deep dive into this occupation, no, so I really was so amazed what an amazing field it is. While you can serve to multiple people, multiple age groups, and it is very satisfying in nature. So I worked 3 years in Institute of Neuroscience, Kolkata. Then I shifted to Pune. There I am attached with the blessed ones. So I worked there and along with my personal clinic.
Oh,
So this is all about my journey of occupational therapy.
that's great. That's great, ma'am. So, if we further discuss into what occupational therapy is and how is pediatric occupational therapy, it is different from occupational therapy that caters to adults or geriatric population. How would you explain it beyond textbook?
Okay, so it's really great to answer this, So before I start, why don't I ask you a question? When you hear about the word occupation, what comes in your mind first?
Something that is related to functionality, functioning, in
Okay.
day-to-day life. That is
Yes.
what I feel.
Yes, that's great. So yeah, occupational therapy, it stands on the words occupation. So occupation for different age groups are absolutely different, right? Like for pediatrics, their occupation, children's occupation is always play. As they grow, there can be studying is their profession or socializing with each other, with another child is one profession. Like we adults, we have our own profession. Like you are an psychologist, I'm an occupational therapist, like that teacher and engineer who all have their own profession. So that is their occupation. Like our parents who are elderly person, so they have their leisure time. That is also occupation. So in any case, due to any acquired injury or any congenital condition, for that they are not able to perform their daily life skills or they're not able to perform their own occupation like we are. So occupational therapist roles comes over there. We help them to regain their functional ability through lots of therapies, lots of different kind of task oriented approach or play based approach according to the age group, so that they can live their life independently in our society in an inclusive manner.
Very, very nicely said. I hope it makes sense to the audience watching there. how is then occupational therapy different from physiotherapy? Because in many forums, we hear parents, they get confused between these two therapy modes when
Yes.
both may be needed for the child.
Yes, of course. So, physiotherapists, they specially deals with the motor part. That is, muscle strength. That can be walking. That can be balance training. These are all the perspectives of physiotherapist. So they will help the adult or as well as the child who are not able to sit, not able to walk. Up to this, they will work. So they're mostly focusing on their functional, they're mostly focusing on their motor part. And what occupational therapist does, along with the developmental delay, like by having that stroke, if someone's is getting paralyzed one side. So along with the functional abilities, we focus on their daily living task, how they become independent and how they become deal their life independently without minimal assistance or independently, you can say. And like their fine motor functions, how they will eat by themselves, how they will dress by themselves, and their cognitive parts. So due to any accident or due to congenital anomalies, you can say, so if someone have any cognitive disability or cognitive delay, we need to work on their cognitions, like attention, orientation, memory, and higher function, how they will execute the task. So basically there lies the difference. Physiotherapist deals with the motor functions, and we deal with the cognitive function, ADL task, hand function, and other adaptive devices to train them so that they can live their life independently. So our main focus is their independence.
So is occupational therapy relevant for all individuals in the spectrum?
Yes, of course. So in this spectrum, you mean to say like adults and
yes, both adults and children.
Yes, absolutely. So like I said, ki occupation, as we started our discussion, what is occupation? So everybody have their own occupation, as I said. So is there any problem so that they are not able to perform their own occupation? There comes the occupational therapist role, whether he or she is adult or this is children. So does not matter ki what is the age group is. So it can start from 2 months to and beyond. It can be done over 80 years also, looking up to their lifestyle or quality of life.
So, when a child is coming to you for occupational therapy, what are the steps? What are the protocol? To reach that finally, these are the activities that you are selecting for that particular child. What is the standard action that you follow?
Okay. While the first child first coming to me, so first we ask the parent what are their chief complaint. For say ki they will say my child does not have eye contact, or someone says my child does not speak. So we start with that. We start with a standardized assessment protocol where structured and unstructured observation are there. So we use different standardized scale like sensory profile, or for ADL we use different kind of standardized scale. So accordingly we find out what in which areas the childs have the problems, like whether he is having problem in motor part or in cognitive part or in daily living skills. So what are the areas they are having the problem? We do full assessment of the child. Then according to identification of the problems, we set our goals, and obviously we focus on the parents demand as well. Like I find something which parent does not want, there can be happen. We focus both our perspectives, how much relevant parents demand is also. So if that is relevant, like they're asking my child cannot speak, so their occupational therapist role is there can be a role, but that can be minimum. So like whether they're asking me a relevant question or their demand is relevant, and what is my observation. So along with these two perspectives, we set the goals for the child so that the child can develop early.
So mostly parents, they come and say, how long will it take? How long will it take for my child to recover?
Yes.
So your take on it?
This is very, very, tough question to handle because there is no particular duration. Every child is different and every child is special. So it absolutely depends on their strength, weakness, and coping skills, how fast they can learn the task or whatever we are teaching them, how fast they can learn that. So depends on that, the time duration varies. Nobody can say ki your child will take only 1 month or it will take 1 year to learn. Nobody can say. Like for example, bead stringing. Everybody I think knows this activity, no? So bead stringing, one child can learn in a day. One child can learn in 6 months. So it's absolutely varies depending on the child's ability and the therapist, and always on the parents ki how we are teaching, how the child is coping, and how the parents making them practice at home. So this 3 points is very much necessary to achieve that goal. But this time duration, nobody can say.
What are the typical things? Because, for people who are not aware of occupational therapy, there are many people who are not even aware of occupational therapy. For them, it at times becomes difficult, for us to explain. So, in a very simple way, when a child is coming, a child in the spectrum is coming, what does a typical occupational therapy looks like for a child?
Okay. As I said, occupational therapy is like an umbrella term. It covers so many areas from like developmental delay, like motor milestones, whether the child is able to roll, whether the child is able to walk, or whether the child is able to sit. So these are the motor perspectives. Next, here comes the cognitive perspective, whether the child is able to follow my parents or someone's instruction or not, whether the child is, he or she might understand the instruction, but there is a problem in execution. After understanding what I am saying, like I am asking the child pick up the bottle, he or she might be understanding ki what I am saying, but there is a problem in higher function, that is cognition, so that he or she might not be able to execute the task. So there can be a problem in cognition part also. Like I said ki the bottle is in the on the table, right? But the due to memory problem, no, the child cannot remember what my parents said, whether it is on table or whether it is under the table or where it is. So there can be problem in memory as well. So here comes second part is cognitive. Third is fine motor functions, like how a child handwriting is, whether he or she is able to write or not, like button here, whether they can button their shirts or not. So these are the fine motor skills. So number 3 is fine motor skills. Number 4 is behavior. So whether the child is behaving appropriately or not. But behavior is like what we can see. I'm sitting like this, right? So you might say ki this is a negative behavior. I might say this is my habit. So it absolutely looks like what you see as a parent or as a therapist. But if there is any behavioral correction needed, so there comes also a autist role. And number 5 is independence. So ADL independence, that is daily living tasks. How do we brush our teeth? How do we bathe ourselves? So bathing, dressing, toileting, etc. So we train them how to make them independent. And number 6 is socialization, because mostly the parents have the complaint, my child does not mix with other child. So there is a huge problem in socialization. So how to improve their socialization perspectives. So motor part, fine motor part, cognition, and their ADL skills and their behavior strategies. So these are the 5-6 points we need to work on.
So it is a very global thing. It is not very specific.
Right.
There are so many things, so many domains that are being
Right.
covered under occupational therapy.
Right, absolutely.
So can you please come along with few strategies? Like, we are very interested because when we see an occupational therapy room, it is very colorful with a lot of things inside, right? So can you please come across with some strategies that, are typically used, and what are the deficits that are addressed by those strategies?
Okay, so we see different colored of multiple, instruments or some play equipments. So to get the child attracted to that, so that the child will not say ki, ma'am, I don't want to do this, or they will be like, no, I want to move out from the room, So first strategy is, of course, building up rapport with the child. So as soon as we connect with the child, we can get better improvement. Second is to make them comfortable in that room. Third is we should be always playful with the child, so that the child feel a comfort zone with you, and he will be very open to learn something, whatever you are teaching to the child, right? So these are the 3-4 strategies, like connecting with the child, and like I said, we need to give them a comfort zone so that they are ready to learn something, and we need to be playful, and we need to keep that something, new ideas, so that the child get attracted to us, or attracted to the room, or attracted to the whole environment. So they're very much open to learn something, because our strategy is to teach them something so that they can become independent.
So you said parents, it also depends on parents,
Yes.
how well the child will improve. So what is the parent's role in occupational therapy?
So as I always said, occupational therapists like us, we teach the child, but the key of success is practice. It is not at all like occupational therapist or occupational therapy. Everyone's, if they want to master in something, they need to practice. So like we have gone to tuition. Right, everyone has gone to tuition, and in tuition what we does, we learn something new, and what we do, we practice it at home. So here, like, who make us practice? Like for neurotypical kids also, it's not only always like neurodiverse kids only. So for neurotypical kids or any normal person, we need to practice it at home, and everybody's parent is they're so much ready. If anybody is learning singing or learning dancing, the parents are there to make them practice at home to masters in some skill. So similarly, for neuro diverse kids also, parents' role is a very important role. I never say ki I'm the person who can cure your child, because autism is not at all curable, but I can teach your child, but you have always make them practice at home, so that the faster the better they practice, the faster they can learn, so they can improve a lot. Like you asked me ki how much duration it will take, so as much as they practice, as much as their parent can make them practice, they will improve, so the time duration will be decreased.
So improvement will be there depending on the child.
Of course. It does not matter whether it is mild, moderate, or severe. So if we are there, like we need to teach them properly, and parents' role is to make them practice and to follow the like routine throughout a day, how to engage their children. So if the parenting strategy, we can teach them properly, so that child can definitely improve, no matter ki, whether he is mild, moderate, or severe.
Saying this, can you please suggest some simple occupational therapy strategies that can be practiced by parents at home? I'm emphasizing on this because at many places we know such therapies, maybe they are not that reachable to the parents, right? So what kind of strategies they can do for their children who are in the spectrum?
Of course, because this is everybody does not get that financial and geographical luxury to get occupational therapy. So yes, there are always been a road to reach to that. So occupational therapy does not mean ki you have to sit and do bead stringing, you have to jump on trampoline, or you have to go through the tunnel. These are not at all occupational therapy means. So as I said, occupation means whatever you are doing. So whatever task you are doing in a whole day, that is your occupation only. So for example, like we teach color sorting, right? In our occupational therapy setup. If I ask a child to put red ball in one basket and yellow ball in another basket, right? How we can perform this at home? Like we and home is the best place. We have so many options to reach out, what we don't have in our clinical setup. So there can be multiple color vegetables, fruits. So they can ask like red apple in this basket and yellow banana in this basket. So these are the transfer of learning also. The child will not only stick to red ball and yellow ball. He will do the transfer of learning. The color is red, but red means does not ki this ball is only red. This pen is also red, right? So they can use multiple objects or multiple what resources what are available at home. Okay. So color sorting is one part. Second is I used to say which kid have multiple sensory issues, right? So they need so much sensory input throughout the day. Only 45 minutes in a clinical setup, it is not at all sufficient for the kid to come out from the sensory processing disorder. So it is very much necessary to give them sensory input throughout the day. So they can use like we use sand activity, right? And I believe in giving them some playful and some purposeful activity. Only just free play is okay, but somewhat something like color purposeful, like if we can make a castle out of sand, so that will be purposeful and the child will be able to learn ki there is something called castle. So they can make sand, they can use sand to make a castle, and they can use rice or different kind of textures while you are teaching your child something like academically, like standing line, slipping line, or whatever it is. So you can use, instead of pencil and pen, you can use different textures like rice, dal, or something like that, rangoli. So that can be colorful. Again, you can teach the color of the rangoli, like in red rangoli you have to do standing line, in yellow rangoli you have to do the slipping line, right? So throughout the day some sensory activities needs to be there. Or like you are washing your clothes, so if you can ask your child to put the clothes in the basket along with the surf, so and mix the surf in the water, so that then also he will get that sensory exposure of tactile. So throughout the day we can plan like this. And here comes the parent's role, as you asked in previous question, ki what is the role of the parent?
It looks really very creative and very insightful. These
Yes.
day-to-day activities that can also facilitate the activities of daily living of the child.
Yes.
It is also said that occupational therapy, it also leads to emotional regulation of children, and it makes them feel calm. So we would definitely like to have few words on it.
Yes. So, as we all know, autistic kids or kids with special needs, they have multiple problems with emotional regulation. They cannot regulate themselves. So, as I said, sensory activities throughout the day. So, some kind of tactile sensitivity or vestibular sensory input, we can make the child calm. Like few strategies are, as I can say, if the child is, but we have to find out in which texture or in which way the child is becoming calm, because it is not similar for every kids. There are some strategies obviously, but we have to research ki, for the particular child which can be the best beneficial way to make them calm. Like for example, we can give some cold water in their face or in their neck, little bit tactile exposure to get them calm, or in the palm, in the feet, so that they can become relaxed. We can give some deep pressure, to make them come down, if they have pressure seeking. Some kids, they respond to free play with the rice or with sand, or someone wants to play with the foam, like little bit sticky textures. So we have to find it out in which sensory input they are responding for their emotional regulation, and to calm themselves down.
So like you said, sensory problems or sensory activities. So
Right.
sensory disintegration, that is often, it is very much used for autism spectrum disorder. So again, can you explain it, beyond textbook, so that we all can understand what sensory disintegration means for a child who is in the spectrum?
Yes, of course. So nowadays, everybody, I think most of the people are hearing this word sensory integration therapy, or sensory integration, sensory disintegration, whatever you say. So basically, sensory integration, if I will explain it in a layman language, if we are getting some sensory input, like as we all know, mosquito bite, right? So a mosquito is biting in my hand, and the information is going to our brain, and how do we respond? We are hitting the mosquito. Everybody knows this feedback and feed forward reaction. So for the child, how he is receiving that information, how his brain is processing the information, and what is the execution he is executing. So these three are there. This is called sensory integration. So sensory disintegration means if we are responding to the mosquito bite in a similar way, more or less, that is normal, because your sensory has got integrated. But someone is feeling like mosquito is biting me so much, I cannot tolerate it. I want to kill him like any way, So there can be hypersensitivity in his skin, or there can be hypersensitivity in his brain, so that he is not perceiving that information in a proper way. So in the perception of the sensation, there can be a difficulty. We have usually, we know ki we have 5 senses, but we have 3 more senses, like 5 senses, so we all know, and the 3 more is vestibular, proprioceptive, and tactile. So in these 3 sensation, mostly the children have disintegration, as you said. If they cannot perceive the information properly, they will have difficulty in learning so many things. Just for example, like eating food using your hand. So everybody here, not everybody, like most of the kids, they don't like to touch the food, or like dal rice, if we are eating, they don't want to touch the gravy of the dal, or gravy of the sabji. So it is very difficult for them to touch that, and if they are touching that, they immediately wipe their hand repeatedly and immediately. So what they are perceiving, ki it is very much harmful for their hands, ki they cannot touch that, and as a result they will be not be independent in their eating. So how sensory integration is hampering our daily life skills. So this is one example. Now how we manage them, like we have to teach them eating. As I said, ki occupational therapist will help in your daily living task. So how we will teach the child how to eat. If he or she is not touching the food only, then comes the sensory integration therapy role. Like we use different kind of textures, from dry textures to wet textures. We give them exposure to different kind of activities. As I said, I mostly prefer to give environmental exposure and some purposeful activities. Like I said, making a sand castle. Similarly, I teach them how to do plantation, so that they will touch the mitti and they will put it in the tub and they will pour water over it. So he is getting different kind of sensory exposure. Like he is touching the dry textures, mitti, and while it is wet, there is some wet textures also. So day by day we give them different kind of sensory exposure, so that they will be becoming comfortable to that gravy texture. And at last we will expose them with the dal rice, where the problem lies. Right, then how to eat. If there is any problem in motor planning, so not only tactile, this is also motor planning is also part of sensory integration. So now he is comfortable in touching the food, but he does not know how to put it in his mouth. So like folding your hand and putting it in your mouth, this needs a multiple motor planning. So then here again we work on the praxis, so that the child will have proper motor planning and he will be independent in eating. So similarly, the child have a fear of falling, or he is afraid of height. So here comes the gravitational insecurity, like he is afraid of climbing the stairs, or he is afraid of swinging independently. So again we give them vestibular sensory input, like we give swing, we give some kind of tunnel activity. So we plan accordingly, so that the proper sensory input they can take, and they will overcome their daily life barrier, what they cannot perform in daily life. So difficulties should be overcome. That's what.
And saying which, there may be many success stories in your kitty, which we are eager to hear, so that it is also encouraging for us. So can you please share some success stories where occupational therapy has really taken the child and the family steps forward to progress?
Yes, of course. So there are lots of stories. As I said, I'm practicing since 7 years and beyond that, because throughout my academic life also now I have practiced. But I can share a recent story of one kid. So the child is very hyperactive. He has gravitational insecurity, like he does not expose himself to any kind of park activities like swing, slide, etc. He has actually lots of sensory issues, right? He does not touch food. Always he does humming. He cannot speak anything. Motor planning, as I said, like apraxia. So he had apraxia, so he cannot do ball catch throw also. So any kind of activity he was not able to do. After taking 3 or 4 months of therapies, now he is able to explore all of the park equipments, or like any kind of activity. He can imitate 4-5 steps, you can say. I would not say he can imitate everything, but in a 3 months of span, he is imitating like 6-7 steps, like hands up, clap your hands, and anything. So instruction following is also there. He can follow almost 70% of basic instructions, simple instructions only, but he can follow that. Third thing, he was not eating anything because of oromotor, sensory issues. So he was not eating anything. He was not drinking water also, not by lifting his hand. And when his mother was trying to put water in his mouth, he was like, I will not drink water. So that he, as a consequence, he had constipation and all. So now he drinks water in using his hands. So he has started that independently. And like fine motor activities also, he was not able to hold the pencil. Now he is able to somewhat hold the pencil, not in a proper grip, because he is a 3-year-old boy. But he has started doing this, right? He started eating some fruits also. That is a big achievement for his mom. Ki now my child is eating fruit, so eating dal, rice and all also, but not by using his hand, but while his mom was feeding him, right? So this kind of, and all the motor activities like ball catch, throw, cycling, and moreover he is socializing with his peer group. That is very important improvement for him, because he was not at all staying among his age groups. Now he has initiated playing with them. So this is a big achievement for him as well as all of us.
And you said the kid is just 3 years old.
Yes, the kid is 3 years old, and he is receiving therapies for 3 to 4 months. Nearly 3 to 4 months.
And such is the progress.
Yes.
Over such a short period of time.
Yes, that's what I told. It's depending on how much, how you are teaching, how your child is accepting, and how the parents is making them practice. So here comes the improvements.
So even, is it early intervention? The
Yes.
earlier we start, the better it is. What's your take on it?
Absolutely, because we know that our brain develops till 2.5 years at its fast pace. So as soon as we start therapies, the child's brain is fresh, and he is open to learn anything. Whatever he will learn, that is fresh. So he is not learning wrong, and we are breaking it up, and again we are teaching him something new. That is not there. Whatever he is learning, he is starting afresh. So this is very much important to start early. It is not like that ki if we will start therapy after 5 years, he or she will not improve. It is not at all like that. But obviously the ratio of improvement, it will be very much slower, as the child's brain has already developed, and his brain is not very much open to accept everything. So there can be some behavioral issues as well, so that can be restrict the child to learn new things. So multiple problems is there, but still they can improve, but it's always best to start early.
Right. So you have a lot of clinical experience. You have worked at different multidisciplinary and neurorehabilitation institutes. So the role of multidisciplinary team and your experience in the efficacy of working in a multidisciplinary team, how will you, justify it?
Yes. So during my entire, professional career, whether it is academics, whether it is work, I have worked in multiple setups. So what the first thing I say, I approach to connect with the child first. If you are saying about child only, then so as soon as we can connect with the child, we can see the better improvement of the child. But we always focus that we are not here to showcasing our practices or our therapy's skills. Our only goal should be the child's development. So as I am still working in a multidisciplinary setup, it is and I'm a huge supporter of multidisciplinary approach. Like a single therapy cannot improve. If I will say, this is very wrong, if I will say ki, send to your child to me and I will give the best improvement to your child, it is not at all possible. It is possible. It is not like ki not at all possible, but if he will come for OT sessions thrice in a week for 45 minutes, we can show improvement like 30%. I can say. If they are coming to a multidisciplinary approach where we can provide them occupational therapy, speech therapy, behavioral therapy, special education, and whatever the therapists are, so there can be 70 to 80% improvement in a same time span. So there is a huge difference you can see if your child is going to a multidisciplinary approach. So we all sit together, like every therapist should sit together and set the goal for the child so that we can give our best to the child. And again, there is no way, and anybody should not showcase their own therapy skills only, because our only goal is to development of the child.
Right. And there are
Yes.
so many, like you said, in occupational therapy also, there are so many overlapping things.
Right.
Behavior,
Right.
emotional regulation, and so many other things.
Right.
So MDD, it works best
Right.
for all children.
Right. Absolutely correct.
And just a final, suggestion to the parents who are watching out there with lots of hope. So any, advice to them as far as occupational therapy is concerned, the ones who are already doing and the ones who are, still they are yet to do occupational therapy. Please give your suggestions.
Right. So for the parents, I must say ki you are not alone first. We are all together with you. You can communicate with your fellow parents also who are going through this journey. So first of all, you are not alone. Second of all, you should not panic so much. Obviously, we should start early intervention, but you should not panic, because you are the best person to take your kids' journey along with you. So it is very important to stay strong and be patient. And of course, I would say every small improvement or every small achievement of your kid should be celebrated to make your child feel proud, make your child feel confident, and appreciation is always a key to get success. So always appreciate every achievement of your child. So you will also get confident ki my child is achieving this. Don't think like this ki this is only a small achievement. We will step up like one step ahead, and we will reach to the goal definitely. But we have to be patient, and we have to celebrate each of the achievement. And what I want to end up this conversation, like everyone, not only parents, all of us should include the child in every social activities or social participation. We need to make an inclusive environment for them so they can also enjoy every kind of activities or every kind of celebration, so that they will also feel enriched. Because we should not forget ki whether it is neurotypical child or whether it is neurodiverse child, every child is flower, and every child has their own right to enjoy everything. So don't keep your child at home. Make them involved in every kind of activities or every kind of function. And we also are there to help you out how to do that, right? So all the best. And it is a long journey. So be patient and, enjoy your journey along with your kid.
Right. And like you say, every child is blessed. So
Every child is blessed.
Yes.
Every child is having their own strengths and own weakness. So we always should focus on their strengths as well as weakness. But we need to focus on their strengths also. Like I think everybody knows the singer Karthik, who was there in Saregama. So he's a huge position now. So everybody called him for a call show. So his parent find out ki what is his strength. He cannot communicate properly, but he sings very well. So we need to find out the strengths of the child, ki what he can do. So that we can, make them enrich to that extracurricular activities as well. Always, it's not about academics.
True. So before we wrap up for this session, there will be a quick rapid fire round where I will be, putting statements in front of you based around some assumptions, myths or conceptions regarding occupational therapy. So you will have to just tell me whether it's true or false, and with a small elaboration if you intend to.
Okay.
So
Sure.
here we start. If a child is hyperactive, they automatically need occupational therapy.
This is not always true, because if the hyperactivity is not harming their learning capabilities, like if their academics or their play, occupational therapy is not needed that much. But if there is any there is any harm, like their due to their hyperactivity they are not able to study, they are not able to sit at one place, their speech is hampered, then occupational therapy is always indicated.
Sensory integration therapy is a core part of occupational therapy.
Yes, of course. This is a core part of occupational therapy. As I said, sensory integration, if not happen, there so many tasks they cannot able to do, and they will be not able to able to be independent in their life. So it is very important, and it is a core part of occupational therapy.
All children with autism spectrum disorder have sensory processing disorder.
Uh, Not always. Not always.
Okay. The occupational therapy for autism and ADHD is not same.
Depends on the child. Whatever the need is, sometimes there can be similar problems as well in autism and in ADHD. So it absolutely depends on the symptom. Some activities or some therapies can be same, but not always.
Occupational therapy is not needed if a child is already in special education.
No, because this is false, because occupational therapy and special education have their own perspectives. Like occupational therapy focus on their motor skills, their fine motor skills. Like if the special educator is helping them in writing or in academics, so occupational therapists need to prepare the child for the pre-handwriting skills. So special educator mainly focuses on their learning and academic skills to enrich their academics part, whereas occupational therapy helps them to make them independent in their ADL and in their school readiness.
Okay. Occupational therapy can support communication in nonverbal children.
Yes, of course. Through multiple, multiple strategies, like using picture cards, using visual schedule, or how to point what their need is. So these are the basic nonverbal strategies that can be taught by occupational therapists. But if the child is entirely nonverbal, he always need to visit an expert speech therapist.
Right. So it was, quite enriching to have you in our podcast, Miss Abhirupa. You have shared your insights, and there were certain myths, certain misconceptions regarding occupational therapy. I'm sure that has got clarified. So thank you so much again. It's a privilege, that we had you in our podcast.
Thanks a lot. Thanks for calling me and giving me this opportunity to share my views as well. If I can help to a little extent to the parents, it will be blessing for me.
Thank you so much.
Thanks a lot.
For the viewers watching out there, if you feel this video is relatable to you, if you can resonate with this video and feel that this video has really empowered you, please do press the like button. Please share our video and subscribe to our channel. Till then, please watch out for the video that is popping onto your screen.